predictable.
No, I guess the question that I would have is that it seems to me like then you're talking about a very small window of opportunity for them to do anything really. It just they're going to run out of time in terms of
That's right.
all
That's
the
right.
election year machinations, and so how is that actually? How are they going to be able to avoid running into that sort of that just sort of ticking clock problem, or is
I
that
think the
something
answer
that
is no.
is
The
escapable?
reconciliation process ties their hands in a number of ways. Number one, there are only certain provisions that they can include in the reconciliation bill. The reconciliation process requires that any changes you make through reconciliation are changes basically in spending levels or in taxing levels. You're not supposed to make policy changes during the reconciliation process, and there are rules to prevent members of Congress from doing that. So if you're trying to change policy, then you will be subject to a 60-vote point of order. That's the threshold. It's back up at 60 votes. So there's very little that they can do through reconciliation procedurally. But consider also that right now the unpopularity of the Democrats' health care overhaul is, well, it's been clocked as high as 61%, and it's growing every day. And that's where they'd be starting over. I mean, they'd be starting to put together a bill with very high negatives on health care. President Obama's personal approval ratings are in the 70s, but public approval of his approach to health care is down in the 40s. So they've squandered a lot of goodwill. And when they started when they started the current process, started putting together the current legislation, a majority of Americans favored the president's approach to health care. But the more they learned about it, the less they liked. And so they're going to be going up against a lot of public antipathy, a lot of public distrust from day one of the reconciliation process, which is going to make their job a lot harder. Then there's the problem you mentioned, which is the ticking clock. Election day is coming up sooner than you think. We get a little closer to it every day, and the closer vulnerable Democrats in the House and Senate get to Election Day, the more likely they are to abandon their president, to vote against their president, especially when, as we've seen, their president can't save them from the voters. When they go, if you watch what happened in New Jersey and what happened in Massachusetts, the president went and campaigned for the Democratic candidate, and it didn't matter, or at least it didn't matter enough because the Republican won in both instances. So I think that even their best options are not very good right now, but it's still too soon to say that the Democrats' government takeover of healthcare is dead.
Let me ask you this, just to go out on it. I'm interested in your take on what you think the eventual point will be that we reach within this next year, before this next election, on healthcare policy. Do you think that there will be any movement whatsoever in terms of insurance reform, or just in terms of a token move, or is this thing just starting to smell so bad that people are just going to run away from it?
It is possible that the Democrats will get something through, and the smaller that something is, the more likely it is to get through. So if it's an expansion of the Medicaid program, that's more likely to get through than the private insurance reforms, certainly. And I shouldn't call them reforms, because I think that they would I think reform is supposed to improve things. It would be tougher to get through an expansion of the Medicare program to the near elderly, age 55 and over. But that is still within the realm of possibility, I think. But one thing is for certain, there will be a health care bill that goes through Congress. The Medicare program pays physicians according to a legislated formula that is supposed to automatically cut physician payments by 21% this year. And that formula has been trying to automatically cut physician payments every year for about 7 years now, but Congress keeps putting it off. And so those are smaller cuts that Congress kept putting off. So there's really no chance they're going to let a 21% cut in physician payments take effect. And when I say physician payments, we're really talking about price controls here. So it is highly probable, almost certain, that the Democrats will pass some measure that will increase physician payments. It'll cost $200 billion or more. They will add that to the deficit. But because there is a health care bill that train will be leaving the station, they may try to get some other items on that train. And that may be a Medicaid expansion. It may be an expansion of the Medicare program to people age 55 and over. But really, either of those options or any other option they might choose is going to be costly, and there will be a fight over that.
Michael Cannon, thanks for taking the time to talk to us.
You bet, Ben.